Hello, I am going to talk about how and why to get a COVID-19 booster. So this is a poster that you might have seen out and about on a bus stop, or on the TV. It's talking about how important it is to boost your immunity this winter with the COVID-19 booster vaccine and also with the flu vaccine, two vaccines that we both really need this winter in order to keep our immunity up to stop us getting unwell. And we know that it's really important to have both these vaccinations, but that sometimes people have questions or difficulties to get the vaccinations. So that's what I'm here to talk about today and to hopefully answer some questions. So these are the frequently asked questions about booster vaccination, and these questions are covered in the leaflet about the booster vaccination, which there is an easy read version of, and the link for that leaflet is on the last slide here. So why do we need a booster dose? Well, we know that obviously lots and lots of people have had their COVID-19 vaccines over the summer, which is fantastic because that will have kept them really protected from COVID-19. But like with a lot of other vaccines, the protection from the vaccine gets less over time, which we call waning. So the longer and longer it goes from when you had your second dose, the less and less there is the protection. So another dose of the vaccine restores that protection from COVID-19. And one of the things that a lot of people are talking about at the moment is this new variant that's called Omicron. And people are trying to figure out what needs to happen in terms of protecting from that Omicron variant. And the data that we have at the moment, it isn't official, but the data we have at the moment suggests that that means it's even more important to get the booster, because the booster gives you much better protection against the Omicron variant than if you just have two doses. So having three is much more protection than having two. So when do we need to have that booster dose? Well, now the government has announced that you can have your booster from 3 months after your second dose of COVID-19 vaccine. So you have your second dose and then you have to wait at least 3 months and then you can have your booster. But although that's going to be the new rule, the booking system and the guidance for the vaccine centres isn't in place yet to let that happen. So at the moment, in order to book or in order to walk in, it will need to be at least 6 months. And the reason that the window went from 6 months to 3 months, the reason to get more people vaccinated quickly was to make sure there was that protection for as many people as possible right now in winter, when we know people are more likely to get coughs and colds at any time. So to provide that additional level of protection at a time when we know people are more likely to get COVID, because just like any other cough and cold, it's easier to catch in winter. So which vaccine is given for the booster? So you may know that there are different vaccines that have been used to give to their first and second doses. Some people had AstraZeneca, some people had Pfizer, a couple of people had Moderna. For the booster vaccine, the NHS is using either Pfizer or Moderna because these are both very effective as a booster dose. And the reason that we know this is because there's been a research study where they looked at people who had all the different combinations. So AstraZeneca, 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 Pfizer, 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 AstraZeneca, AstraZeneca, Pfizer, 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 Moderna, any of the combinations you could think of. They looked at all those different combinations. And what they saw was that the best thing is to have either a Pfizer or Moderna for your booster vaccination. And it doesn't matter which vaccine you had before. So it doesn't matter if you had AstraZeneca before or you had Pfizer before, you can have either of these as a booster now, and it will all work really, really well. So what about vaccine side effects? This is something that a lot of people are worried about when it comes to vaccination. And side effects from vaccination are different for everybody. So some people, when they have a booster, they find they have fewer side effects than they did from their previous doses. And some people find that the side effects are a bit worse after their booster. And this depends on individual people and also what vaccines you will have had before. After a booster, the common side effects are like any other vaccine. So they will include pain in your arm, feeling very tired and sleepy, and maybe a bit sort of what we call flu-like, and having a headache. These are very mild side effects, and they usually go away after a day or two, and you can take paracetamol to help with the symptoms. But some people get them badly, some people don't get them badly at all, some people don't notice. But for everybody, it is much, much better to have the side effects of the vaccine than to have all the things that can happen if you get COVID. Is there anyone who shouldn't have a booster? So almost everyone should have a booster. If you want to talk to your GP, it's a good idea to talk to your GP if you had a really bad allergic reaction to a COVID vaccine before, because that might mean that they have to use that to decide which vaccine you get this time. Or it's possible if you're immunosuppressed, if your immune system is affected by medication you take, like if you had cancer treatment, you might have had a third dose recently, and then you might be needing to have another booster. It's all quite complicated. So if you think that you're confused about whether or not a booster is the right thing for you, the person to talk to is your GP. It is safe to have a booster if you have other underlying conditions. So if you have asthma, or if you have any other kind of conditions you take medication for, or if you're pregnant, it's completely safe to have a booster. And in fact, it's even more important to have a booster if you have other conditions, because that means you could be more vulnerable to COVID infection. So why are we focusing on people with learning disabilities and boosters? Why am I talking about this? Well, we know that 90% of people on the learning disability register in the east of England have had a COVID-19 vaccination, which is really great. That's so great, because that will mean over 90% of people having that really good protection from vaccines. But we know that for people who have a learning disability, only 49%, so only about half of the people with a learning disability who are eligible for a booster, so for whom it's time for them to have a booster, have had their booster. Whereas for everybody else, it's 73%, so nearly 3/4. So 3/4 of the general population, but only half of people with a learning disability. And we want to make sure that people with a learning disability are protected the same and equally with everybody else. So we really want to make sure we're doing all we can to help people with a learning disability get their booster. So at this seminar, what I want to do is for everyone to talk about what we can do in the vaccination programme, what agencies like ACE Anglia can do, what the learning disability team in the East of England can do to support people with a learning disability and their families to get booster vaccination, so we can understand why that uptake is only half and why it's lower than we'd like it to be, and what we can do to solve the problems and answer the questions that people might have. So just to finish up with, I just wanted to address this bit as well, which is how to get a booster. So you can book a booster vaccination at the NHS website, and I've put the link here, but you can Google that as well. And if you would struggle to use the internet, or you can't use the internet, and if it's broken that day, you can call NHS on 119 and they will help you book a vaccination. You can also look for a walk-in vaccination near you without having to book an appointment. So somewhere where you can just turn up on the day. You might have to queue for a while, but you don't have to have an appointment. As I said before, at the moment, you're only able to do these things if it's at least 6 months from your second dose. But the guidance will be changing quickly. So I'm recording this on the 8th of December, and but day by day, it may be that has changed. So see what it says on the website on the day you're looking at it. Now, I know it's very important to note that when you look for an appointment or a walk-in, you may not see a site that's near enough to you to work for you. But there are sites that come on, vaccination sites come onto the web page every day. So when a vaccination centre or a GP or a pharmacy that has the ability for you to book appointments, they figure out what their appointments are going to be on a day-by-day basis, and they add those into the system. So if you go on the site and there's nowhere that works for you at a time that works for you, do check back another day or later that day, and you may find something that is more convenient. You can also ask your local pharmacy. There's lots of local pharmacies that are involved. They may not be on the website, but they might be able to give you a booster. And if all else fails, you can also talk to your GP. But everyone is going to be really keen for you to be able to get a booster. So please ask, and we will be able to find someone who can help. But the main ways to look are on the NHS website for either making an appointment or a walk-in, or calling NHS 119 and they can help. And that's all my presentation for now. Thank you.